the operation center. That is the story of Ebola. If everybody is honest, everybody is strict, adheres to the rules, this would not have happened. Even Sawyer would not have come here.
He would have stayed where he was. He would have been treated, been managed. He probably would have survived it, and would not have spread it to this country as we now know it. Dr. Dubanjo, now, when you look at this issue of public health, how serious can we be? Let's leave government out of this now. As Nigerians, how serious can we be about it? How serious do we need to be about it to ensure that we don't have an epidemic on our hands?
Well, I'm happy you said leave government out, because I think what Ebola is bringing to board is the fact that this is collective responsibility, and that if people did what they were meant to do, really, most diseases and things will be well taken care of. In most instances, like now, we keep talking about hand washing, for instance, and people are practicing that as a ritual, and it's not a ritual in itself. And I always like to explain to people that this is what we should have been doing all along. We do it all the time. Somebody comes in with a cold, we don't want to shake him. If we do, we want to wash our hands. I said we should have been doing that all along. So Ebola is only re-emphasizing, the personal hygiene, the collective responsibility about behaving right, about cooperating with the health authorities, about being your brother's keeper. It's all those same things we've always known.
Perhaps it will boil down to the fact that some people, this issue has really not, been so much taken in by them, because if you know that if you have had contact with an Ebola person, and then you know that you're going to transfer it to another person, or you can also die from it, why would you want to live, where you're being under surveillance and being watched to see that you don't have the virus? Do you think Nigerians are really taking in this message?
Well, I think there are a few things to think about there. One is the message we passed across, when Patrick Sawyer came. We spread panic. First we started telling everybody it's a death sentence. So people also thought, maybe I have no choice here. Go to the health authorities, I get locked up till I die. Otherwise, let me try to help myself. That's one. The second one is the stigma, which is that it looked like you're a dead package, and nobody should deal with you in that sense. We should see it as another disease, which in fact could be well taken care of, as Nigeria's case has shown clearly, with good examples, people who survived. And in fact, the good thing about the survival is that the virus actually gets eliminated, which again tells you there's no reason for this strong stigma, as it were. So it's about caution, but not stigma. The fact that I avoid contact is caution, not that I see you as a bad person or something like that. So I think that's what it's pointing out to us. And also it speaks about distrust to some extent, that we don't seem to trust the health authorities, which we should, because again, they work in our best interest.
Okay, let me ask Dr. Toyindo then, why should Nigerians trust the health authorities?
Well, Nigerians should trust the health authorities, although I would say the health authorities have a lot of work to do to build that trust, because over the years the trust has been eroded, because some of our health facilities are not that, the health system is not that strong enough. And then the people, sometimes when they seek for health, they are being, especially in public health facilities, they have been, they have issues with bureaucratic issues. Yes. So they go there and they don't get the help that they need on time. So, and then the culture of the people, they seek alternative medicine. So it's not about Nigerians not trusting the government has to build that trust.
Okay,
so,
but you are on the NMA, Nigerian Medical Association Ebola response team. What have you seen so far?
Well, the response in terms of the facility, the things on ground, they have tried a lot. They've done a lot to contain the situation, and you can see with Lagos, it has worked, except for the diplomats there, because the people are not forthcoming. They didn't come out with the right information, and then they just disappear, like maybe because of fear and stigmatization. So that is why we had this new case in Port Harcourt. But then the things on ground are quite working. Communication awareness program, the treatment center, and then the contact tracing. Everything is
okay, let me ask Dr. Jinadu, are we doing enough in terms of public enlightenment on this issue? Because if you have a situation like the gentleman who traveled all the way to Port Harcourt and has come back, one would expect that the moment his name is mentioned, or that first his name will be mentioned, it will be made public, and everybody that has been in touch with him will be encouraged to go get tested and be under tracking surveillance consistently for the number of days that is required, 20 days, 21 days, whatever it is, that effort will be there and everyone will rally around. Are we doing enough?
Oh yes, we are case tracking. He would list his contacts, where he's been, who he's been with, and we work backwards. You must understand the fear of stigmatization, of creating unnecessary panic. This is no time for panic or alarm. It's just caution and a deep sense of responsibility. That is our need now. And the case tracking is well underway. And of course, you know, there are different types of contacts. There's the type 1, the person who's been in contact with his fluids, who has had to clear his vomitors, etc. Then there are just those people who have shared the same accommodation with him. And then there are those who have remotely passed by him in the corridor, etc. So it's not everybody you bring in, but definitely case tracking is being well carried out. It's just the dishonesty that's rearing its head now.
What I'm looking at the moment is, if we're really going to contain this, there's going to have to be something that is truly robust in terms of the effort, and it goes both sides of the divide. On the one hand, in terms of information on the side of government and the awareness for the people, and then on the other hand, for the people to know that you have to bring yourself forward. What are we doing to ensure that both work together hand in hand?
The media. That's why we are here. The message everybody needs to have is that once you have had contact with an Ebola patient, once you're on the surveillance list, you do not travel out. And whilst you're on the surveillance list, anytime you have a fever or diarrhea or vomiting, you alert the surveillance officer immediately. All those who have survived have alerted the surveillance team quickly, all of them.
You know what has happened in Liberia? I'm sure you know about the number of cases there, over 500, is that, and the president actually attested to this, that there is denial. People don't want to accept that this is Ebola. They don't want to see the quarantine center in their locality. What are we doing so that we don't get to that point in Nigeria?
I think we've gotten to that point, but we are curbing it. And denial is a normal human response. Don't forget, we've always had it with the HIV positive cases. Denial is a normal human response. But the message of health, it's a non-death, it's not a death sentence, is what we need to get across. People would deny, but once people the person affected knows his chances of survival is high.